All right, good evening, everyone, and thank you all so much for being here today. I want to first start by thanking the residents of San Francisco for complying with the order to stay at home unless absolutely necessary for essential needs and also for our, of course, essential services that the city continues to need during what we know has been a very challenging time. We know that this is an evolving situation, as we have said before, and our goal is to make sure that we do everything we can to communicate with the public exactly what's happening on a day-to-day basis. And we know that as an evolving situation, things change, and we need to adapt. And when we adapt, our goal is to make sure that we do what we can to communicate clearly to the public, but also to remind everyone this is about public health and public safety, and that has always taken the forefront of all the decisions that we've made with the advice of some of the most world-renowned public health experts in the country. So today I want to talk about just a few announcements and some adjustments to some of the things that we have been doing because, as we said, the order went into effect midnight today. And so far, so many residents have complied, and we appreciate that. And then we also know that there are more questions, more concerns, more issues, and I hope to address some of those issues today. So I want to start with some additional steps that we've taken to support our business community. We, in addition to a moratorium on residential evictions, thanks to Governor Gavin Newsom, we have the ability and we have issued a directive on commercial evictions as well. And so we wanted to make sure that businesses as well as residents are not who will be impacted, most likely, sadly, due to a loss of income, that the last thing they need is an eviction in the midst of this crisis. And so the fact that we were able to put a moratorium on both residential and commercial evictions in the city will hopefully have an impact on supporting our small business community. So we made that announcement today. This action applies to businesses with a permit to operate in San Francisco with gross receipts up to $25 million. Now, this is in addition to what we've already announced for our business community, including deferring business taxes and licensing fees until next year, February of 2021. We also launched a relief fund where small businesses can receive grant funding for assistance. And we also made it clear that we will continue to support our nonprofit organizations, the nonprofit organizations that serve our city, so that many of those services that are provided to our homeless population, to our senior population, and to our youth can continue to receive support. And we're continuing to work with our philanthropic partners on a particular fund that will provide relief to residents of San Francisco, again, those who are financially impacted by the loss of income due to the coronavirus. I want to once again encourage employers and employees who are impacted to go to the website www.oewd.org/COVID-19. And also, if there are questions and you do not have access to the internet, you can always call 311 if you have any questions. We will continue to do all we can to support our business community. We know that this will have a tremendous impact on our economy here in San Francisco, but throughout the country. And so what we want to at least do is everything we can now to help get people through this challenge. We're also taking additional steps to strengthen our capacity to respond. In talking with Dr. Grant Colfax, who is currently at our Emergency Operations Center, it's clear that we need more capacity in our healthcare system to deal with the potential challenges, including hiring more nurses and healthcare workers. And so today I waived the provisions around hiring rules so that we can hire qualified, registered nurses on the spot. We know that this process typically, unfortunately, through our city bureaucracy can take up to 6 months. So instead of going through that normal process, we will act now and we will not waste time, and we will get those qualified healthcare workers up and running as quickly as possible. Finally, we received a number of questions regarding parking and cannabis. In terms of parking, the SFMTA will stop issuing tickets related to street sweeping and will waive tickets that were given out today. We understand for people who are quarantined, it may be impossible for them to move their cars. However, for those of you who can move your cars during street cleaning, we ask that you do so. It helps us to continue to keep the streets clean as much as we possibly can. Your full cooperation would be appreciated at this time, but we wanted to be clear that we won't be issuing tickets for street cleaning. In terms of the cannabis dispensaries, the Department of Public Health today clarified that since cannabis has medical uses, dispensaries will be allowed to operate as essential businesses, just as pharmacies are allowed to do. So I wanted to give you all those updates, and at this time I want to ask Jeff Tumlin from the SFMTA to provide some overview and just some updates about what's happening with the SFMTA. I know people had a number of questions around parking, around tickets, around towing, around things related to Muni, and so Mr. Tumlin is here to provide you with an update.
Good evening. My name is Jeffrey Tumlin, Director of Transportation for San Francisco. As the mayor has already said, this is an evolving situation for all of us, and our policies will continue to evolve along with advice from the mayor's office and the Department of Public Health. For the latest information, you can always go to our website at sfmta.com. As the mayor already said, effective midnight tonight, we will no longer be enforcing the rules for street sweeping, but as she also said, it's important that our streets not be allowed to get filthy. So if you can move your car for street sweeping, please do so. This will allow the street sweepers, which are continuing to operate, to be able to keep our streets clean. In addition, citations that were issued today for street sweeping violations, those will be waived, but you will need to follow the waiver procedures on our website. As we announced yesterday, we are waiving all late fees and late penalties and deadlines for the duration of the health emergency for the full array of parking citation and other citations that we have imposed over the last months. The other guidance that we issued yesterday still applies. We will be enforcing rules related to public health, safety, and the accessibility of services. So this means double parking in the bike lane, not allowed, can be cited. Parking in the transit lane can be cited. Similarly, it's very important for people who are being quarantined that they still be able to get to their grocery stores, the pharmacies, and other services. So we will be continuing for the time being to enforce parking meters to make sure that parking availability is still there in our neighborhood commercial districts. There's plenty of other detail that is available at our website, and we, of course, will be happy to take questions later. I believe that I'm now turning the mic over to Dr. Navina Boba from Public Health, or back to the mayor.
Yes, thank you. Thank you, Mr. Tumlin. Also, I just wanted to reiterate that we will not be enforcing the parking permits, residential parking permits, so there will be no ticketing for residential parking permits at this time as well. Now we will have an update from Dr. Susan Phillips with the Department of Public Health.
Thank you. Good afternoon. I'm Dr. Susan Phillip, Deputy Health Officer and Director of Disease Prevention and Control for the San Francisco Department of Public Health. We all know the coronavirus emergency is continuing to change rapidly. I want to thank Mayor Breed for her leadership in supporting the unprecedented shelter-in-place order that was issued by our health officer, Dr. Tomas Aragon, and also issued by the health officers of the 5 other most populous Bay Area counties. We believe that this aggressive action is necessary to preserve health and will save lives. And we thank the people of San Francisco for their cooperation, which we can see just outside of City Hall and on the streets of San Francisco right now. We know it's not easy, but we want to thank San Franciscans for doing what they can to help preserve lives. Our stay-at-home order is very broad, and we know that there will be a lot of questions that come out of this. Because there'll be distancing steps that will be needed to prevent transmission of the virus, but we still need to allow for essential activities. We've tried to explain to the best of our ability what that would entail, and there's a very good frequently asked questions document available at sf.gov that everyone should take a look at. But these are broad categories, and there'll be nuances. As the mayor clarified, one area that we want to talk about today is cannabis. So for years, the San Francisco Department of Public Health has recognized that medical cannabis is an essential medical service. We have been permitting cannabis, medical cannabis in San Francisco long before it was legal in the rest of California. And since 2004, over 24,000 people in San Francisco have been issued medical marijuana cards. People rely on medical cannabis for chronic pain, seizure disorders, muscle spasms, depression, and multiple other disorders and conditions. So I want to clarify today, as the mayor has said, that cannabis dispensaries are allowed to remain open for pickup or delivery of these essential medical treatments. People who require cannabis for medical purposes will be allowed and permitted to use home delivery services or pick up from dispensaries around San Francisco. On-site consumption at the dispensaries will not be allowed. Our preference to maintain social distancing is that delivery service is utilized. Again, I want to emphasize that we shouldn't lose sight of what's most important, the reason that we're doing this today, and the reason we see these clear streets and sidewalks in San Francisco, which is so heartening, is because of protection of health and safety. And we know this is very difficult on everyone. We're very grateful for leaders like Mayor Breed, the Board of Supervisors, other leaders in the city who have really taken these bold steps. Our health priorities, as voiced yesterday and by Director Grant Colfax, really remains protecting the most vulnerable populations who are at risk from coronavirus, including older persons and people with chronic medical conditions. We are trying to do that by reducing community spread, and the shelter-in-place order is a way of doing that. And we are protecting health workers and our healthcare capacity against a sudden surge of people who are very ill and require treatment. Our healthcare workers are a main focus because they are on the front lines protecting us every day, and because they are needed when people become ill and present for care with COVID-19. We must provide these workers with the support, protection, and supplies they need to respond to COVID-19, and we are committed as a department to doing that and as a city. So in terms of healthcare workers, as you have heard from the mayor has issued a declaration to expedite the hiring of nurses and other healthcare professionals in our Department of Public Health system. This will be a critical boost to our system's ability to prepare today and respond tomorrow to coronavirus as an emergency. COVID-19 has put significant pressure already on our healthcare systems and around the world. San Francisco is moving proactively to hire more healthcare workers so that the city will be ever more prepared to respond to COVID-19. Healthcare workers are courageously on the front lines, keeping our community safe and healthy every day. And today's action will allow us to bring on more nurses quickly, to be prepared to meet the demands of the response, and to augment and support the workforce that is already there in place and working hard every day, often overtime, extra days in order to staff our hospitals and clinics. We will speed up today with today's declaration the hiring process from 6 months, as the mayor has said, to a period of hiring on the spot for qualified applicants and starting within a week. So this weekend, DPH will host an invitation-only nurse hiring fair at Zuckerberg San Francisco General Hospital, and will continue hosting hiring fairs until all vacancies are filled. These fairs will offer same-day hiring, and new nurses will be at work as soon as the following weekend. We're seeking to fill about 100 nursing vacancies, RN vacancies, across the board in many areas, with an emphasis on emergency and intensive care unit nurses that we know will be needed. This escalated process is part of our city's response to COVID-19. It builds upon the HR improvements that are already underway and sped up our plan, which was already in place, which was to reach 45 days to hire. However, we understand that that is too long for an emergency, which is why the mayor issued the declaration today. The difference that this will make, it will bring on 100 new nurses to staff our hospital and our clinics. It will allow us to employ permanent staff and use fewer per diem or hourly staff and agency staff. It'll result in improved continuity of care for our patients and will increase our capacity to serve patients as well. And this is just part of the overall readiness that we have been undertaking as part of our hospital systems and DPH systems for a surge, including stocking supplies, meeting regularly to discuss planning, reducing patient volumes, thinking about reducing elective surgeries and non-vital outpatient services. All of this to make sure that we have a well-trained and well-supplied workforce and are prepared for COVID-19. Thank you.
Thank you, Dr. Phillips. And we have with us Police Chief Bill Scott to talk about the first day and what his officers have been doing throughout the city to help communicate the stay-at-home order that had taken effect at midnight last night. Chief Scott.
Thank you, Mayor Breed. Good afternoon, everyone. So I want to start again thanking Mayor Breed for her leadership on this issue. As we see, we believe our city is really ahead of the game and one of the four leaders in trying to address this issue and prevent the spread. With that, the San Francisco Police Department yesterday, or today actually, beginning at midnight, commenced to doing bar checks and restaurant checks. Now the order went into effect for midnight today, as the mayor described. At midnight, our police officers were dispatched at the district stations around the city to actually follow up and check with the bar owners or operators and the restaurant owners to make sure that we were having compliance. I'm happy to report that we had no issues last night. I can't guarantee that we checked every bar in the city, but we checked every bar that we could, every restaurant that we could, and very pleased to say that San Franciscans, by and large, are adhering to this order, and particularly in terms of the bar closures and restaurant closures. As we speak right now, our officers are on the streets. We also are checking businesses. We are asking again for voluntary compliance. It is really important that everyone pay attention to what's going on and comply voluntarily. However, this order does have the ability to enforce. It is a misdemeanor to not comply with this order, and as a last resort, we will be prepared to enforce. One of the things that I would like to say to the public is think of it this way and make everyone's life easier. If you have someone in one of these vulnerable populations that you care about, it should be personal to you. Think of that person. Think of that person in your life that you care about, that you care deeply for, who's in one of these vulnerable populations, and then think of whether or not your actions may put that person at risk. I think if you reflect on that, your answer would probably be the right answer, and it makes everyone's job, including our San Francisco police officers, much easier, because we will get to voluntary compliance. And that is what we're asking everybody to do. The department is in good shape overall. Our radio call load has been managed properly. We're working within the city infrastructure to make sure that we respond in a coordinated fashion with the rest of the city entities and departments that have a stake in this. And so far, things are running quite smoothly, but it is a very, very rapid evolution. and we have to be adaptable and flexible and be ready to respond to whatever comes up next. So that is where we are, and thank you for your time.
Thank you, Chief Scott, and just wanted to open it up for any questions.
He doesn't expect public schools in California to open again before summer. It was quite shocking to hear.
Yeah, I'm sure it's quite shocking, just like where we are now. When I first issued the declaration of emergency on February 25th, there were a lot of people who basically didn't understand why I was doing it when we had no cases to report in San Francisco, and we are at 43 at this time, and we've seen in other countries without intervention, without planning, without doing what we're doing here today, the impacts on public health in those particular communities. I think that the governor is being realistic about what we need to prepare for. I think that we prepare for what might happen, and we are, in a better situation if things change. We should prepare for the fact that kids may not be able to go back to school and finish up the school year, and what are the alternatives? What are we going to do once we are over this hump? I think we're just, he is just preparing us for the long-term impacts. This is not something that we think, based on the science, based on the data, based on working with our healthcare experts, that we think is just going to blow over like a cold or a flu. This is significant, and we want people to understand the severity so that they can follow the orders that we're putting forth. And unfortunately, that could include, the school year could be potentially, not possible for kids, which is extremely sad and unfortunate, but we need to prepare for that.
USD right now?
We are basically working with SFUSD in whatever way we can. I mean, right now we're working with them to make sure that, for example, the Western Addition didn't have a location for those kids to access food. And so we're working with them to make sure the school is clean and prepared and readily available right now so that kids who may not have access to food have access to food. So whatever we can do, we are definitely going to work with the school district to be as supportive as we possibly can to provide resources to the children of San Francisco, and that has to be our priority.
Mayor, excuse me, Mayor Breed, can you tell me on day one of this shelter in place, how would you describe how everything has gone so far?
I think in just really being out there and paying attention to what I see on the streets, I mean, the streets are, fairly empty. There are less cars on the streets. There are less bikes. There's still people who are walking. I noticed there are more people walking, walking their dogs, walking at distances with one another. So I noticed that more people seem to be getting out and just leisurely enjoying, the outdoors, probably just to get some fresh air. And I noticed a lot of businesses that are closed, a lot of places that are closed. Some restaurants, for example, Les Boulangeries had the window service in Hayes Valley, and just the coffee shops have been open. And you notice that the members of the public have been following the social distance requirements that we've enforced. And I think for the most part, San Franciscans have been great citizens. They've been really, they've really stepped up to the plate and listened to our orders, and have also done a lot to help educate others on what that would mean. And day one so far has been, it's been okay, but this is day one, and we have 3 weeks to go, and maybe even longer. And I think it's important that people understand that we probably need to be prepared for the long run, but also we want to make sure that we make it clear that essential city services will continue to be open and available. The deliveries can happen, the pickups can happen, the grocery pickups, the pharmacy pickups. And one of the things that I've constantly said to people is just think about those who are less fortunate, who can't get as much toilet paper as someone can buy, or someone who can't get all of their pharmaceuticals that they need for a whole month because they only have enough money for one copay. I mean, we have to just be a little bit more considerate in what we see happening all over the country, and people, buying up things and hoarding, and what that might mean for other communities that may not have the financial ability to do that, which is why it was important that we maintain the operations of those essential places like grocery stores. And the large grocery stores aren't the only things that are available to people. There are community grocery stores that are open, that are stocked, that have resources, that provide an essential service just as much as some of the large grocery stores do. And we would encourage people to take the opportunity to take advantage of some of those markets. Gus's in Haight Street is open and available, and there are other markets and other places throughout San Francisco that will be an incredible resource for communities.
I know it's only day one.
Overall, we are at a better place than we were yesterday. Overall, as a country, people are having serious conversations about doing exactly what San Francisco, along with the other Bay Area counties, have done. We know that others have already joined here in Northern California, because ultimately, yes, it's important for us to do that here in San Francisco. But this is not an isolated problem in the city or in the region. It is something that is impacting our entire our country, our world, and we all need to do our part and be prepared. And the sooner we can basically focus our efforts on social distancing and making sure that we're sheltering in place and so on and so forth, the sooner we could probably get through this. And I think that's where we are. But we also have to be realistic about, the people that we know will need, the nurses we need to work, and the doctors and the medical professionals and our police officers and our firefighters, our emergency personnel. So there are people that we need on the front line, but we also need to protect them. So it's going to be a real challenge as we move forward. But today, the first day, was the biggest challenge for us on this first day was definitely the parking and the citations and the concern around cannabis for medicinal use and those sorts of things. But we got through that, we made some adjustments, and that's what we're going to be doing moving forward.
Governor Newsom was also talking about surge scenarios. He mentioned there are 2 hospitals, one in Northern California and one in Southern California, that he can take over and open up. Is that hospital here in San Francisco, and what will that look like?
I'm sorry, is what possible?
Is the hospital he's talking about in Northern California, is it here in San Francisco? There's been talk about CPMC.
Well, I'm not prepared to provide that information at this time, but I will say that it's important that we look at every single resource that is available to us to use, whether it's to have a hospital that's ready to help with patients, or that we have a hotel or other locations available for those who may have to self-quarantine. Those are the kinds of things that we have already been looking at and will make public if necessary when the time is available to do so.
The surge scenarios, do we have a timeline of when it's expected in San Francisco if a surge happens? And also, do we have an update on the 30 folks that we learned about yesterday who are waiting for their test results?
So first of all, I want to be clear that, again, we will announce and provide that information to the public once we have it confirmed. What I don't want to do is speculate or give a guess as it relates to a timeline without having accurate information, so that we are putting out what is true, what is going to happen, what is fair, and definitively to the public. And so when that is available, we will have that information and make it available as soon as we possibly can. Right now, we are at 43 people who have been diagnosed with the coronavirus here in San Francisco. And we will provide information as soon as we know how many cases once those tests come back. There are a number of and maybe the Department of Public Health if you want more details around the testing and what's happening there. We're doing tests here locally here in San Francisco, which is why we're able to get the results back sooner rather than later, but they're still implementing the CDC guidelines for who can actually get tested based on whatever their symptoms are. So that's where we still are, because we want to make sure that we are using the tests that we have wisely.
Can we talk more about, either from you, Mayor Breed, or Dr. Phillip, about the hiring fairs, the specific dates, times? I know you said Zuckerberg General, and then also I've seen 4 posts today on social media from San Francisco healthcare workers, from Kaiser, from Sutter, CPMC, all the different facilities. These people are on Nextdoor, on Facebook, all the social media platforms, asking for donations from their neighbors for personal protective gear, masks. They want Clorox wipes. What is going on in our hospitals in the past 24 hours? Are they out of supplies as it pertains to PPE, personal protective gear, and also sanitizers?
Okay. Dr. Phillips, you want to respond to that?
Yes, thank you, Mayor Breed. So I think the first question was about the hiring fairs and how that's going to be. So this is an invitation-only hiring fair. The first one is going to be this Saturday at Zuckerberg San Francisco General Hospital, and it is going to be comprised of a group of people who have already applied and been qualified for the position. So the Department of Public Health and Department of Human Resources will be reaching out to see if those people are still interested. Those RN nurses are still interested in the position, and then they'll be invited to come to that fair and complete the final parts of the onboarding process then. And the goal would be to complete the process for the people that are eligible and interested that day, and that they would start working a week from that day. So an incredibly fast turnaround for hiring 100 positions for RN nurses into our San Francisco Department of Public Health and Zuckerberg San Francisco General Hospital system. The second question you were asking was around PPE and what the status is of that across the city. So as part of our Emergency Operations Center and our Departmental Operations Center at the city level, we are coordinating the supplies that exist in the city of PPE. We're working closely with every health system. We're working closely with the California Department of Public Health, and also with partners at the federal level at Health and Human Services. We are constantly seeking to obtain more shipments of PPE, and we are working together collaboratively to make sure that the PPE we have is allocated appropriately to people that are working on the front lines and who have the most potential for exposure to COVID-19. So usually that will mean people that are working in emergency units, people that are working with patients who have been diagnosed with COVID-19 in the hospital, and those are the folks that we're making sure have the equipment that they need.
Healthcare workers have the equipment they need right now to stay safe? Because that's the message that I'm getting, that they don't have it and they're asking their neighbors for it.
Yeah, I can't speak to asking their neighbors for it and what that means. What I can tell you is that we've been working closely with the hospitals. They are telling us that supplies are low, and we're all strategizing about how we can obtain more PPE, but that there's been no instance in which a worker has been asked to go into a situation to evaluate a patient or to care for a patient where they have not had the equipment that they need.
Since you said you're reallocating that PPE and, say, an orthopedics unit would maybe have to go to an emergency department?
Well, those decisions are being made within health systems too. You know, we're not commandeering all of the PPE that exists within the health system, but we're having discussions, and leadership across the board in all the health systems and the hospitals are in agreement about how we should all be working together. We are also looking at any supplies that we can come into San Francisco and how those are distributed. They're not going to just one hospital. We're looking at hospitals jointly, and I think that's a very important point to bring up, is that a lot of our advanced planning, a lot of our surge planning, all of it has happened jointly with all of the major hospitals and healthcare systems, and with the idea in mind to make sure that all workers are kept safe as they advance this important work.
People are commenting on these posts from our healthcare workers. They want to help and donate masks and Clorox and whatever they have. Is that allowed? Is that even safe to bring in PPE or cleaning supplies from the outside?
So that's a good question. And so for people who are healthcare workers, there's a specific type of respiratory protection that's required. We talk about face masks and surgical masks. That is not sufficient for some of the type of work and some of the procedures that people will be doing. It requires something called an N95 respirator. Those have to be fit tested for each particular person to make sure it fits their face and forms a good seal. So there's some specialized equipment that is not readily available through the internet or through stores. So I understand people's wanting to help and provide that equipment. It's not always the appropriate equipment in every situation.
Is there anything people can't do because people desperately want to do something?
I know people want to do something and they want to help their neighbors, and quite honestly, it really comes down to the health officer order and the order that Mayor Breed has announced with Dr. Colfax. And the thing that each of us as citizens can do that makes the most impact, that will save the health of health workers the most, is to reduce the numbers of people that are needing to seek urgent and emergency care. When people are coming in and they cannot breathe and they have to be intubated emergently, those healthcare workers, they are thinking about saving that patient. We want to reduce the number of times that happens so that they have the time to say, do I have the right PPE? Do we have everything we need? We will draw less on our resources of PPE. We will draw less on our resources of human talent if we reduce the number of people that end up going emergently into the hospital. So that is what every San Franciscan can and should concentrate on. So we applaud what's happened so far, and we need it to keep up for the next 3 weeks.
We've heard several, the governor, we've heard the mayor mention possibly longer. As time goes on and people get restless, can anybody anticipate the largest public problem? I mean, I would guess people will get restless. I don't know if there's an experience that you're looking to where this has happened before, where 5 days in something happened. Is there something that you're anticipating that we can warn people against?
Well, as you know, as we in San Francisco have dealt with challenges. We've dealt with medical challenges, we've dealt with earthquakes, we dealt with the aftermath of 9/11 and other things, and this is something that is unprecedented. And I can't think of in our recent history where we've had to take such drastic measures to basically shut the city down for a medical purpose. And so I think that we can't predict the future. We don't know how long we're going to be in this situation. We know that, people are going to get restless. We know that this is uncomfortable and it is frustrating. And all the leisurely services that we would normally do, most likely, like go to a bar or go to a nail salon or get a massage or do certain things, those things aren't available. And the fact is, this is really about saving lives. And this is why we have to take such drastic measures. And what that means is getting creative with what we provide the public of things that can be done and ways in which people can stay, kind of active within their homes for the purposes of making sure that they're not out there in the streets, tracking this virus and getting other people sick. And I think some of the things I've seen online, for example, John Legend is doing a free concert, and different folks are putting forth materials and information where kids can learn at home. And we're also looking at ways that we can support those families and those kids that may not have access to the internet to make sure that those kids don't fall behind. And so over the next couple of weeks, we're hoping to come up with a number of ideas and things that we can propose to help as we deal with this very serious challenge. I mean, this is going to require a lot out of all of us. It's going to test our patience. It's going to test our resolve. And what we want to do, first and foremost, is make sure that we are communicating to the public as much information as we have, accurate information, and simultaneously dealing with the impacts on the economic health of the city, the concerns around how people get food and access to food who can't leave their place. I mean, we have seen in some instances where neighbors are grocery shopping for other folks who can't, leave their homes. And so it's going to be a challenge, but I also feel like it's bringing out the very best in people in this city. You know, and I think that we're in this for a longer period of time than we had anticipated, and here we are, and we're going to get through it, and because we have no choice but to get through it. So here we are, and we'll get through it.
President Trump obviously discussed his stimulus package today and is trying to get $1,000 out to people who qualify for it in the next 2 weeks. I know personally someone here yesterday who owns a restaurant bar had to lay off 28 people. This is San Francisco, this is the Bay Area. Is $1,000 going to keep people afloat? What do you think of what he said today, and is there anything more that San Francisco and the Bay Area can do for our people?
Well, I think the bigger challenge for us is, again, as I said before, we can't wait for the federal government to lead the way on what is the best thing to do as it relates to this challenge, which is why we are doing the very best we can with many healthcare professionals and other professionals who have experience around things that can be done to help us deal with this. And so I've already rolled out a number of initiatives, as I said, you know, where number one, we have, you know, extended the deadline for taxes for our businesses. We also, and I failed to mention earlier, we also launched paid sick leave for people who work in San Francisco who may have exhausted all of their resources with their employer. And we are providing not only advanced paid sick leave to employees for San Francisco, but we're doing that for those who work in the private sector and helping our small business community. And you asked earlier, how can you help? Well, we have established a fund, and we have gotten contributions from many companies in San Francisco with the goal of allowing people to reach out to access this fund for additional resources that they may need. So for example, if someone was laid off and they need to pay for groceries or they need to pay for something in order to get them over the hump, you know, this is designed to help people who are in the situation after they've exhausted maybe the unemployment benefits or any other benefits that they are due. We have other resources that can kick in and can assist. Do you have the information for that fund and how people can donate? So it's give2sf.org if anyone wants to contribute, or if anyone wants to find out more information on how the fund can help them. All right, thank you.